For the best medical and paramedical lectures, subscribe to our channel and press the bell icon to stay connected with us.
Everyone, welcome to our channel Nursing Association. I am Chaitanya Naik, studying in 3rd year BSc Nursing at Government College of Nursing, Kim Subli. Today I am going to explain about breast self-examination. Breast self-examination is the best and easiest method to diagnose the breast cancer by self. Before knowing about breast self-examination in detail, we should know what is the statistics and scenario of breast cancer in India. It is the most common cancer in women in the world. It is the second leading cause of cancer deaths in women. In India, 60% of breast cancers are detected at an advanced stage. 1 in 8 women diagnosed with breast cancer in their lifetime. About 1 in 3,000 pregnant or lactating women have breast cancer. Reason for increasing breast cancer in India is lack of awareness. And in India, women are too shy or not comfortable speaking about their problems related to breast. Every human being must understand that breast is just another part of our body, and it is not only important for women to know about breast self-examination because 1% of all breast cancer is found in men. Now beginning with definition of breast self-examination, it is a technique which women use to assess their own breast to detect carcinoma at the earliest. Articles required. The simple articles which are available in every home are required to conduct breast self-examination. They are mirror, gloves, small pillow or roll towel. Now I will explain about the techniques of breast self-examination, like how and when to conduct breast self-examination. First one, stand in front of a mirror. Examine your breast with hands at sides, then clasp overhead. Look for changes in size or shape or nipple changes. Squeeze both nipples between thumb and forefinger to check for discharge. Then press hands on hips and push elbows forward to tighten chest muscles. Look for dimpling, puckering, redness, scaliness, or changes in size, shape, texture, or skin color. Then the second one, in the shower. Breast self-examination is easier when your skin is wet and soapy. In the shower, raise your right arm above your head. Think about the breast self-examination grid as you cover your entire breast area using the touch technique described above. Repeat for left side. Then the third one, lying down. Lying down helps to flatten the breast, making it easier to examine the breast tissue by pressing it firmly against chest wall. Place a pillow under right shoulder. Begin at the armpit and make a series of 3 small circles. Use light, medium and deep pressure. Cover your entire breast area and repeat for left side. Now the most important part of breast self-examination, that is steps of breast self-examination. There are 5 steps. I will explain all of them in detail. Step 1. Stand in front of a mirror as shown in the picture. Check both breasts for anything unusual. Look for discharge from the nipple, puckering, dimpling or scaling of the skin. Now the step 2. Step 2 and 3 are done to check for any changes in the contour of breast. As you do them, you should be able to feel your muscles tighten. The contour means an outline representing the shape of breast. Watch closely in the mirror as you clasp your hand behind your head and press your hands forward as shown in the picture. Note any change in the contour of your breast. Now step 3. Next, press your hands firmly on your hips and bow slightly towards the mirror as you pull your shoulder and elbows forward as shown in the picture. Note any change in the contour of your breast. Now I will explain step 4. Step 4 of the examination can be done while taking shower. Your fingers will glide easily over soapy skin so you can easily concentrate on feelings for changes inside the breast. Raise your left arm. Use 3 or 4 fingers of your right hand to feel your left breast firmly, carefully and thoroughly. Beginning at the outer edge, press the flat part of your fingers in small circles, moving the circles slowly around the breast. Gradually work toward the nipple. Be sure to cover the whole breast. Pay special attention to the area between the breast and the underarm, including the underarm itself. Then feel for any unusual lumps or masses under the skin. If you have any spontaneous discharge during the month, whether or not it is during your breast self-examination, see your primary provider. repeat the examination on your right breast. Now the last step of breast self-examination, that is step 5. Step 5 should be repeated lying down. Lie flat on your back with your left arm over your head and a pillow or folded towel under your left shoulder. This position flattens your breast and makes it easier to check. Use the same circular motion described earlier, then repeat on your right breast. Then lastly, role of nurse in teaching breast self-examination. First, teach the steps of breast self-examination as described earlier. Then instruct patient not to use creams, lotions or powders and not to shave underarm 48 hours before the examination. This is because some creams, lotions and powder can cause contact allergies leading to armpit swelling as one or more lumps. And shaving can also cause armpit lumps due to ingrown hairs or small cuts in the skin of armpit. And then explain that the breast self-examination should be performed after menses, 5th to 7th day for premenopausal women and first day of the month for postmenopausal women. Then educate even men to perform a monthly breast self-examination and obtain a clinical examination every 1 to 3 years because 1% of all breast cancer is found in men. Then educate the patient to palpate her breast during shower as the fingers will glide easily over soapy skin so that one can concentrate on feeling for changes in the breast. Then, during breast self-examination, pay special attention to upper quadrant area and the tail of Spence where about 50% of the breast cancer develop, and then determine if patient is taking oral contraceptives, digitalis, diuretics, steroids or estrogen hormones. These medications may cause nipple discharge and hormones may cause fibrocystic change in breast. And lastly, instruct the woman to report if any tenderness or nipple discharge exists. And lastly, I want to thank you all for watching this video. Please do subscribe to our channel and don't forget to like, comment and share this video.
Do like, leave a comment, and share with your friends.